Now, before you feed a child, whether an infant or a toddler in a childcare facility, make sure you discuss with the parents. I keep mentioning this, it's very important. Discuss with them about when, what, and how much to feed their children. When does the child like to eat? What does the child like to eat? What are the things they prefer you to feed the child? Consult with the parents. They may give you specifications as to the type of snacks, water, or probably meals their kids can take. Some will even tell you to use only the meals they provide or only the water they provide. So, whatever their instructions may be, write them down in your personal journal and feed the children in line with the parents' directive and even more professionally. Do not do things that the parents do not approve of. It may not be appropriately accepted. So since feeding is also part of the core activity of the children, it is important that you pay attention to them. So we'll be looking at how to feed the children using the various feeding methods they are used to and how the feeding time can be used to foster their learning and development. Starting with bottle feeding, the type of food infants and toddlers take may be to drink probably milk formula, perhaps juice, cereal, or water from a bottle. So, as the caregiver, when feeding an infant from a bottle, you need to provide the things that will help this process run smoothly, which involves a bottle, a nipple, a bib, a cloth to protect the infant's clothing, and a towel to put over your shoulder for burping. These are very important things, and these are things you need. So you need to make sure they are there, available and ready. Now, the things you also need to do is to make sure that you test the temperature before giving a bottle to a child. Drip a small amount of the liquid onto the inside of your wrist to make sure it's cool enough. A lukewarm bottle water is perfect for a child's mouth. Not too hot, not too cold. As soon as it's too hot, it becomes a challenge. If it's too cold, it becomes a challenge. So you need to make sure it's lukewarm. Now, to avoid the spread of germs, do not touch the nipple to your skin. It's very important for you to pay attention to this. Now let's look at spoon feeding. Now, when feeding children with a spoon, you also need to prepare the things you need for that, which is a dish, you need the food itself, you need an infant or toddler spoon, and a bib. So it's important. Now, what are the procedures? You can warm food by putting the container of food into the hot water, put a small amount of the food on the inside of your wrist to make sure it's cool enough. Now, be careful not to touch the spoon to your wrist. It is important. Do not touch the spoon. You've seen now that these are minor things that caregivers don't pay attention to that causes children to have infections. These are just it. And if you don't pay attention to these basic things, the children will just keep getting sick because you have germs with you. You've been up and down, running, carrying children up and down, caring for them, going everywhere. So there are germs around you. So you don't expect infants who are still developing, and then you put their you just want to feel if it's hot, and then you put the wrist the food, and then make sure that the spoon is touching your wrist. That's a challenge. The children will begin to get sick. So put a small amount of the food on the inside of your wrist to make sure it's cool enough. Be careful not to touch the spoon to your wrist. Lukewarm food won't burn a child's mouth. Infants who are just beginning to eat from a spoon, they may seem to be pushing this food away. It's normal with them. So yours is just to make sure you're patient and keep feeding them as long as they seem interested. But for toddlers, you may allow them to try to feed themselves sometimes if they've gotten to that stage and they want to try it out with a spoon if they are willing. So if they make a mess, allow them. Help them as much as you can to make all the mess. Eating is fun to most children, so allow them to have all the fun. You can always clean up afterwards. So that's what makes them children. Let them enjoy it. Try to make them sit in a family setting and make sure they have their fun with others while watching others too. So it's part of learning. We're going to see some of those things. So it's important you pay attention to these things when feeding the children. Now, let's look at what not to do during feeding. Now, do not warm a bottle in a microwave. It's a sin. Warm the bottle in a bowl of hot water To heat up a bit, afterwards, place the bottle in water to become warm. That's the best way to do that. Watch and make sure it's not too hot for the child. Remember, anything that is too warm for you, that means it's too hot for the child. That's how you compare. So long as it's too hot, too warm, maybe you look at it's warm for you, it's too warm, then it's hot for the child, and you can't feed that child with that. So be cautious also. Do not force a child to eat. Do not blow on food to cool it down. You are passing infection to the child. Let it cool down itself. See? I'm sure you're seeing now. These are the things that many caregivers do. They are caring for a child, yes, but they are also causing more harm than good. So it's important to pay attention. You begin to blow on food to cool it down. You're blowing infections from your mouth to the child's food. By that, you might be wondering, I've done everything right. What have I done wrong? I'm doing everything right. How come this child is always having infections, stooling and vomiting, stooling and the child? You have passed infection from your mouth to the child, even though you're doing other things right. This thing alone can cause it, okay? So it's very important. So these are the things you must make sure you avoid when feeding the children. Now let's go ahead and see how all this feeding can foster the children's development. Okay, how does feeding foster development? Now, all feeding times, either meal and snack times, provide opportunities for providers to promote development in all the domains, emotional, social, language, and the rest. So, how does it foster emotional development? During meal times, infants can discover their likes and dislikes in regards to taste and textures of foods. They feel pride and satisfaction when they can feed themselves. They also feel a sense of satisfaction when their need for food is met by the provider. And you get to see them display anger and frustration when they are hungry and are not offered food in time, or probably they are offered the kind of food they don't like. You see an outburst of anger. So feeding foster emotional development in children, either positively or negatively. But our job as providers is to make sure that the positive emotions are developed. This is very important. Now, social development, how does feeding foster it? The young infants being held develop attachment to the caregiver who is always meeting their needs in a nurturing manner. So you see them develop that attachment to that caregiver. They also get to interact with other caregivers, teachers, and their age grades, especially when they are sitting with during meal times. They gradually learn table manners from others as they observe how others behave and probably how their caregivers act. So that's social development. Now, what about motor development during feeding? Infants, they tend to develop motor control, particularly the grip and the control of utensils as they feed themselves. So this development progresses as they grow from basic sucking to the abilities to eat from a spoon, to chew, to drink, and from an open cup. So these are some of the things that develop during feeding. Now, language, the caregiver is key to the development of language. When you talk with infants about what they are eating, labeling and describing items, probably by responding to their words or gesture requests, you extend their effort to use a language. You tell them name of things when you're feeding them. They might not be able to respond at that particular time, but they are developing language, and gradually you see them repeating after you what you're saying and all that, describing objects, labeling and the different items to them. So it's very, very important. All those things are developed when feeding, feeding is being done. All these developmental domains are being fostered during feeding. So it's very, very important. Now, let's proceed to see the next infant and toddler care process, diapering.